My name is Ivkovic. I come from Zagreb, Croatia. I'm an orthopedic surgeon and a professor of orthopedic surgery. And basically, I'm a knee surgeon, although I do hip and foot and ankle, but primarily I'm a knee surgeon, and this is my interest. So TKA module is a part of a bigger picture, which was drawn by ESSKA board and the ESSKA officials quite a few years ago, and it's based on the certificate is based on a core curriculum, which is kind of an interesting because it aims to standardize things that we do across the Europe. So I think it's a very ambitious project and very good one, and total knee arthroplasty module is just a part of that story. So what we are trying to do is to standardize all the procedures across the Europe, because we come from different cities, from different countries, we have different education, we have different hospitals, and if you try to standardize that, then you kind of have a better mobility between those countries and cities. If you want to go somewhere and you say that you have an ESSKA certificate in certain part of certain area, it seems like a good start. So the TKA model, this is the first one. It has been designed according to the bigger picture, bigger scheme. All the modules are the same, more or less. We have a theoretical part, hands-on part, and then we have a case presentation by the participants. So far we had really excellent experience in this facility here in Watford, London. It's well organized. We have a beautiful lab. The participants are very motivated and quite skillful and knowledgeable. Before they came here, they had to pass through the theoretical part, which is 50 questions, and the limit is 80%, so it's quite high. So you need to answer 40 answers has to be correct. So it's quite a good group of people. And I think that so far we have been experiencing really good energy, and I think that until the end of the module, it's going to get even better. Certification program, in my opinion, is a fantastic way to standardize things and to make them more, it is very important to understand. Orthopedic surgery is quite a good discipline to standardize things. It is mostly elective, especially the arthroplasty part, so you can plan and you can standardize these things. And if that is the case, so this is a perfect opportunity to create a program like that. So as a surgeon, first of all, you benefit from being in this group of people and try to benchmark your skills against your colleagues and also against instructors and what have been envisioned by the core curriculum and the arthroplasty module. Second of all, you get a chance to do networking with people. Someday you might be able to call them. At least that's what I do. I always, when I have a problem, nowadays I have all those phone numbers and WhatsApps, and it's a really game-changing experience for someone who is doing this. So you're not alone, but actually you have all your European friends, and you can contact them, because this is a true value. Also, maybe in the future this will be a part of a bigger picture. So maybe in the future this will be part of some official program. So if you're an orthopedic surgeon in Europe and if you want to do total knees, maybe someday this will be a way to test if you can do this. Like let's say, for example, as an SAT test, which is a standardized test. If you do it anywhere in the world, you can benchmark yourself, and it's accepted by anybody who wants to evaluate you. So if you graduated and you did your residence in Croatia, you want to go to UK or Germany, if you did ESSKA certificate module, whatever that is, it's kind of, for somebody who wants to employ you, it's much easier and much elegant for them. And finally, for me, it is very important to at certain point in time, once you have your career going on, people that you meet in conferences and courses and become your friends. So this is something that is quite important, because we don't live alone. And I think it's not all about profession and surgery and business and profit. You need to have good energy from your friends and to share that energy also, not with them, but also with participants. And if they feel it, I think that we have achieved our goal. If I were younger, and to go again, I would absolutely do a certificate module. I think it's a perfect opportunity to test your skills. And I think it is very important for every person, but especially for physicians and surgeons, because we have such a great responsibility towards our patients, to go outside of the comfort zone once in a while. And, this certification project and certification, this is not a course. You're not here to learn new stuff. You're here to be examined. Maybe you are doing this for the last 5, 10, 15 years. But if you have to be tested in front of your peers, this is definitely not easy. So you're stepping out of the comfort zone. And I think it's a kind of, it's a very liberating experience once you did it, because and you get more confidence in what you do, especially when you have a validation from your instructors and your colleagues that what you do is okay. Of course, there is always place for improvement, but ultimately I think it's a very liberating experience. So my message to younger colleagues would be, keep your eyes on the horizon. If you're starting, there are enough resources online and during the ESSKA events and conferences. And also many of the instructors, they go around these events. So if you have a chance, talk to them, try to pick their brains and see what they will tell you. And of course, there are many different certificate modules you can choose from the ACL and meniscus and multi-ligament and total knee and so on and so on. Probably in the future will be more. So my advice would be go online and then try to talk to some of the instructors. I think that would be a way to go. So for more experienced surgeon, I think it's also very good because as someone who did it already, I was really curious to see how would I measure against my peers and colleagues. What would be required for me? Is that something that I can do? Do I have the time to do this? Would that improve my knowledge? And answers to all these questions is yes, because you need some time to go through the theoretical part. So you read new papers, you make your mind busy, you make your mind going forward, try to expand on what you know, because sometimes when you are doing your everyday work, it comes a little bit of a routine. So you try, you do your routine and you go home and you go back and you go home. But sometimes you need a little bit of, to go out of the balance and see what's new. How can I approach this? How can I do this? So even for experienced surgeons, I think it's a very, very good opportunity to step out of the comfort zone, to come to the beautiful settings, to be with friends, to be with colleagues. So even though if you're experienced, I'm pretty sure that this is something that you can benefit very much.